Misalignments. So as you enter, this video is live recorded, and for that reason, your audio and video has been muted, but the chat room is still open for you to ask any questions that you may have. So we usually do these talks in person, but due to COVID, we've had to move to an online platform. This talk is not going to be long. It's going to be roughly 20 minutes. And then there's going to be a 5-minute question and answer period at the end. Now, if you have any questions throughout the talk, you can just go ahead and put them in the chat, and then we'll try to do our best to get to them. Now, generally, this is a required attendance for all new patients, to better understand what chiropractic is. And tonight, I'm going to introduce some new ideas about health, and hopefully learn some really good, useful information. So for tonight's agenda, we're going to cover 4 main things. So first, we're going to talk about the wellness journey that you're going to go through while under care. We're going to talk about what is chiropractic, what the misalignment in your spine is actually doing and how it's affecting your entire body. And then finally, what you should expect. Now, this is a quote from B.J. Palmer, and B.J. Palmer is known as the developer of chiropractic. He was the son of D.D. Palmer, who founded chiropractic, and B.J. played just a major role in developing what chiropractic is today. And he said that medicine is the study of disease and what causes man to die. Chiropractic is the study of health and what causes man to live. So he really introduced this new way of thinking about what it means to be healthy. For example, by the time, say, you get sick, right, your body has already failed to ultimately keep you safe, right? So he looked into what we can do to prevent your body from getting to that point. And he also introduced the concept of adaptability, and he really applied that then to the body. So your body is constantly having to adapt to its environment, and when it fails to do so, this is where chiropractic really shines. So let's talk about your wellness journey. All right. Every person goes through these 3 phases of healing. So you have the restorative phase, the transitional phase, and the wellness phase. So the restorative phase is generally when you're in pain. This is when we see patients this is right when they walk in through the door and we're seeing you for the first time. Now, then moving on to the transitional phase, this is when you begin treatment, right? And this is generally the phase that takes the longest, and it also varies from person to person. But this is the transition of getting you from in pain to out of pain. And now there's the wellness phase, right? The wellness phase is all about staying out of pain and prevents you from regressing back into pain. Okay? So I'm going to pose a question right now. So which of these 3 phases do you think is the most important phase? I'll give you a couple seconds just to think about it. It's the restorative phase where you're in pain, the transitional phase when you're getting out of pain, or the wellness phase when you're staying out of pain. So it is actually the wellness phase, right? And why? Why is it the wellness phase? So this is where your body, when you're in the wellness phase, is functioning optimally. You're out of pain, you have increased mobility, and your body is able to adapt to its environment at the best of its ability. So it's important that when you get there to do your best to stay there, and you do this by getting regularly checked. So number 1 done. Now we're going to move on to what is chiropractic. So for that, let's talk about what happens when you get a fever. So say an infection enters your body, right? Whether that be a viral infection or a bacterial infection, it causes a variety of different symptoms, such as you have coughing, sneezing, you can have runny nose, you can have watery eyes, and also a fever. So now I focus on the fever because this is different from those other symptoms, right? Those other symptoms, the runny nose, watery eyes, coughing, sneezing, is actually the infection at work, right? Causing you to spread the disease. These are why you have these symptoms, right? But the fever is actually your body at work. This is your body's immune system responding to the infection, fight it off. So now I make this distinction because generally when people get a fever, what do they usually say? When they say, oh, I'm getting sick, they say, oh, I'm going to go to the doctor, right? And generally when you go to the doctor, you're prescribed some sort of medication. And ultimately that medication would lead to in the symptoms, right? Now, if your symptoms are having a fever, then that medication is going to shut down that fever. It's going to bring your fever down. Now, why is that a bad thing? And I'll tell you. So, the reason why your body responds by raising the temperature within inside your body is because it provides a really bad environment for those viruses and those bacteria to thrive. So when the internal temperature is at 100 degrees inside your body, the bacteria and the virus have a very difficult time spreading or even living. So it actually kills off the bacteria and the viruses. But when you have medication that's bringing down your fever, your body has a very difficult time shutting off that one immune system function that is protecting your body. So this is why you have some people who go 2 or 3 weeks of being sick, because ultimately we're suppressing our immune system with drugs. Now, what does this have to do with chiropractic? And it's the immune response, right? So your immune response, it's your body's ability to fight off any foreign invaders and keeping your body healthy. So this really means that your immune system is not functioning appropriately. So you have all these organs in your body, and they all play a key role in keeping you healthy, right? You have some non-essential organs such as your gallbladder and your spleen, which you can ultimately live without through medical intervention. Then there's also essential organs that you have, such as your heart, your lungs, your liver, and ultimately your brain, which you cannot live without. But collectively, these non-essential and essential organs, you need both of them to function and thrive optimally, right? Now, what chiropractors do is they work directly on the nervous system, right? By adjusting segments of the spinal column to reduce nerve irritation. Now, what does that mean? It's a lot of words. I'm going to break it down a little bit. So the picture on the left shows a ideally healthy spine, and you have several vertebrae over here. The vertebrae are your backbones, right? And you can see them. Let me try to get my cursor on them. So each one of these vertebrae are your backbones right here. Now they're separated by a healthy disc, okay? And you have really good curves in your spine. And for those of you who went through the report of findings, we talked a lot about the importance of the curves in your spine. Right now, between each one of these bones is a hole, right? So the hole that we're referring to is this one right here. So there's 1, 2, 3. So if you keep going, you can see all these holes, right? Now, the reason I point these out is because this is where your nerve exits spinal cord, okay? So in between each one of those holes, there is a nerve that exits out of that area. And you can see that in this picture on the right. Okay, so inside of your spine lives your spinal cord, and it attaches to all the muscles and organs in your entire body. So now when you have a misalignment in your spine, it can actually put pressure on some of those nerves that are coming out and ultimately cut off what is the power supply. And we call this interference, it's causing some kind of interference. So chiropractors work by removing this interference so that your nerves can, that flow can go freely. Now let's talk about what misalignments do to your spine. We kind of touched on it, but here's a little GIF, right? So as the vertebra becomes misaligned, and remember I brought up this hole that's right here, right? There's a nerve that comes out of there. And as you can see, as it becomes more misaligned, that hole gets smaller and smaller. And this is essentially how some of your nerves can ultimately become compressed. Now, when you have a misaligned vertebra, right, it can cause multiple things. It's not just the nerve irritation, but you can have a swollen disc, you can have inflamed joints, you can even have muscle tightness in response to this nerve interference. And then ultimately, your nerve is also interfered because this hole is getting smaller and smaller as the vertebra becomes more. Now, why is this important? So here is a very lovely diagram. This is a diagram of your autonomic nervous system, but this is your nervous system at work. So you have blue and red, right? So you have these signals that are sent from your brain to your body. This is your body, which is represented by the red signal. Then you have these signals that are sent from the body to the brain, which are the blue signals. Now, what happens when you have a misalignment in your spine? Right? The connection is either slowed down or disconnected. And this brings you to what we call the safety pin cycle. So here's the safety pin. And we want to look at this diagram first. Right? So when you're healthy, we want to imagine that the top of this safety pin is your brain. The bottom of this safety pin is your body. And when it is connected, right, this shows proper communication between your brain and your body. So in this state, this is when you're healthy, right? So health is possible when there is clear nerve communication between the brain and the body. So that is represented by the safety pin being fast, right? The body is able to best adapt to its environment in this state, right? Tissue cells of the body function as they were designed to, and the brain can properly control and regulate the entire body in this state. Now, when there is a disconnect, right? This is synonymous with having misalignments in your spine, having your nerves compressed, right? We call this ill health. So ill health is represented by an unclasped safety pin, right? This is represented by partial loss in nerve conduction between the brain and the body. You have some impaired nerve messaging, and they're affecting both the incoming and outgoing information from the brain to the body. This is, like I said, essentially when you have some sort of misalignment in your spine. Now, what chiropractors do is we remove the misalignment and remove the nerve interference. So we help your body become clasped again, in a sense, and we essentially get you back, your body back to this state of being healthy. Now, what causes you to become misaligned in your spine? So there's three things that we go by. It's thoughts, traumas, and toxins. So let's go through it. So thoughts, so stress can actually cause your spine to become misaligned. Now, what do I mean by this? So if you're stressed, right, your body is in a stressful state, a lot of the times your muscles can become very tight, okay? And tight muscles over a long period of time can actually pull your spinous, on your vertebra in a certain direction and actually cause you to become misaligned. Then you have traumas, right? These are things like car accidents, falls, even playing sports, right? All of these will create traumas, and this is the one that people most commonly can relate to. Then you have micro traumas. This is the thing that people don't really think about. This is the poor postural habits, right? So this is, say you're sitting and you're crossing your legs all the time. This is also just having your shoulders rolled forward from having poor postural habits of sitting and not having good ergonomics when you're at work, sitting for 8 hours at a time. These micro traumas can ultimately cause your spine to become misaligned. And then lastly, you have toxins. So saying something like smoking, right? Putting unnatural things into your body, and your body is unable to respond to those toxins appropriately, even something like air pollution or certain medications can cause your body to react poorly, and ultimately lead to stress and cause you to have misalignments. Right. Now let's talk about what to expect while under care. So we listed 4 things, right? Adjustments to hold, talk about your x-rays, computerized muscle scans, and achieve wellness phase. So for the adjustments to hold. So when you're under chiropractic care, we're looking to see how your body ultimately responds to the adjustment. So this is why we are consistently testing and tracking your muscles and your nerves to see if there's any changes that have been made. Right? Now, the goal is to get your body and your spine to become stable enough to go longer periods with ultimately not getting adjusted. So this is what we refer to as your adjustment for holding or not. With X-rays, right, there may or may not be significant changes in your X-rays. The spine that we generally work on often has had many traumas and misalignments for years prior to seeking care. But the goal is to first make sure that your spine is not getting any worse. And then along the course of treatment, hopefully seeing some positive improvement. We're looking to make sure that your body as a whole, we look at your body as a whole, and the X-ray is one part of that whole. So there's your X-rays, your muscles, your nerve scans, and then also how you're feeling. The muscle scans, the myovision scan that we do on visits 8, 16, and 24. So the muscle scans are a great way of tracking the transition phase while you're under care. So you see some fluctuations as you have been getting adjusted, right? But you will, your muscles will begin to activate in areas that they hadn't before, and some of the muscles that were really tight may begin to calm down as well. So we'll use that as a tool to really track how your body is functioning. And then lastly, the main goal of chiropractic care ultimately is to help you achieve a wellness phase. Okay, so what this looks like is, say you're currently having an acute condition and you're coming in 3 times a week to seek care. So once your body becomes more stable, eventually we'll drop you down to 2 times a week, then 1 time a week, and then once every other week, and then once per month. And generally, you want to go once per month just to get regularly checked up to make sure that you're really maintaining your wellness phase, to prevent you from regressing to you were in the past. So that is it for today. Thank you for joining us for the new patient orientation. If you have any questions, you feel free to just go ahead and ask. Great. Looks like we're all good. If no one has any questions, we'll end it there. Thank you once again for joining us. Have a good night.